Talking about kegs and eggs, fertility and oocytes. Talking candid while having a drink or two. You'll hear real talk from a real genetic counselor who's miscarried multiple times before. It's time for Katie Lee CGC.
Hey friends, it's me, Katie Lee, CGC, and today is Kegs and Eggs, where I talk about my fertility, my oocytes, and have a drink with you. Today I'm having this new mint tea that I got. No idea how to pronounce this brand, but it literally looks like puka, which I have been feeling a puka. So pukey lately. So this is 3 mint tea, and it is so delicious. It's late at night, thus the change in scenery. But I wanted to record this video while everything was still fresh in my mind because today I got a second opinion from a new RE. Actually, it's more of a third opinion from a new RE or a new reproductive endocrinologist. So I've been working with a reproductive endocrinologist in my area, just outside of Denver in Colorado. And I've also got an opinion from another RE in Colorado. And I suppose I'm just not happy with what they are recommending me, which is IVF with genetic testing. There are quite a few reasons I feel that that is not a good option for me. One, I've had pregnancies tested after my miscarriage, and there is proof that at least one has been chromosomally normal. Two, I am 30 years old. My miscarriages have happened at 28, 29, and 30. And I just don't believe for a second, given me and my partner have normal karyotypes, that all 5 of these miscarriages were due to chromosome imbalances. And therefore, I am not interested in IVF with PGTA because I don't feel like I need to bank embryos. I don't think I'm going to be having children like into the next decade, into my 40s, when my egg quality has declined. I know my egg reserve is good from my fertility workup. And I just don't think we'll solve the problem. I think what would happen if I do IVF, and I've heard this from many RPL ladies who are younger, is that I would go through a tens of thousands of dollars worth of IVF expenses and find normal embryos, chromosomally normal or euploid embryos, transfer them back into my uterus, and probably have a miscarriage because we don't know why I keep having miscarriages. And just finding a genetically normal embryo is not going to, in my opinion, improve my chances significantly. I also am just not somebody who's super interested in IVF. It's hard for me to imagine ever putting myself through that for multiple reasons. I think I can get into that in a different video. So anyways, I wanted to get another opinion with a different RE, and Dr. Aimee, I'll link her website down below, is amazing. At my last job, she was a provider I came in contact with once in a while, and I really felt her passion, and I felt how much she cared for her patients. In addition, every single patient I've talked to at that job who was a patient of hers was just over the moon about her care. And I know, given my situation and the other REs I've seen, that I wanted somebody a little bit more open-minded who was not just going to push IVF with PGTA. And also, I really do want someone on my court. Like, I feel like in RPL, in recurrent pregnancy loss, you're just like on this bus alone because it is only about 1% of women who have 3 or more pregnancy losses. I don't have friends who've gone through RPL. Even when you go see an RE, RPL is a relatively small subset of the patients they see, especially RPL in younger women. So I just wanted somebody who can advocate for me and who's passionate about it. And I knew that was Dr. Aimee. She also has this amazing podcast called The Egg Whisperer. If you are at all interested in fertility genetic counseling, preconception genetic counseling, or you yourself are struggling with infertility or miscarriage, you need to listen to her podcast. It is so good, and you can just feel the passion oozing out of her. Like, because she is so well loved by her patients, she of course has a wait list. This is common with most REs. You can't just, get in the next week. So I made the appointment, I think a few months ago. And at the time, obviously I wasn't pregnant, but I didn't want to cancel the appointment because then you just need to hop right back on that wait list. So I wasn't sure if Dr. Aimee was going to have much to say about my current pregnancy or if she would have more to say about plans and next steps if I did experience another miscarriage, but I was curious. And I will tell you, the RE who is currently treating me in Denver, or I should say, I guess was treating me in Denver, they wouldn't even see me in the office because I wouldn't do I didn't do my HCGs levels and I didn't come in for an early ultrasound. So, I mean, I don't know. So on to my consult with Dr. Aimee. I was so impressed, you guys. She knew my whole history. She knew the workup I've done. She knew that I had miscarriages. She knew that I had a living son. Usually when you go into these appointments, maybe not usually, in my experience, oftentimes when you go into an RE appointment, even though you've spent hours gathering your records and filling out the history, you are often regurgitating that history again. And maybe 10 minutes, if you have a kind of long history like me and have done a lot of workup, is spent with you just reviewing that history of everything you already typed into the portal. That did not happen with Dr. Aimee. I just so appreciate that she is that type of provider to be completely prepared. She even had a list of what she wanted to talk about with me. She had a list of things for me to do for my current pregnancy and questions to ask about my current pregnancy, and a list of things for, she said, for my third baby, which I really hope is true. A list of things I might want to do for additional workup that are a little more outside of the box if we have trouble conceiving a third, or if we want to further investigate things before we try for a third. I don't think I'm going to get into the specifics of what she recommended, just because I think they are specific to me and the workups that already been done and my history. But it was amazing to have a doctor be like, boom, 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 here's what I thought about based on what I know about you. And then boom, 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 backup plan. If this pregnancy doesn't work, or for baby 3, here are things you might want to think about. She asked me plenty of times if I had any questions about anything. Dr. Aimee and her team were super quick getting me my prescriptions that she recommended. And I guess I will mention, so I had told you guys, I think that I just didn't take progesterone this pregnancy. I just didn't care. Progesterone, the kind that has always been prescribed to me, it's vaginal, and you have to use this tampon applicator thing. I'll show you one sometime. You have to insert this tablet that's this big into your vagina. And it dissolves, and it's so disgusting. You get so much discharge in your underwear, and it's just bleh. So I had done that the last 2 pregnancies that resulted in miscarriages, the progesterone suppositories, and I just was not feeling it this time. I'm like, okay, it hasn't worked twice. I'm not going to do it again. Dr. Aimee was like, get back on that progesterone. What are you doing? So I'm going to start doing that again. And then she also said, let's try lovenox. Lovenox is an anticoagulant that reduces the risk for blood clots, and blood clots can be a cause of miscarriage or RPL. And also interesting, it's an injectable. So instead of swallowing something, putting something in my vagina, I'm going to be injecting this one. So I thought we could do my first injection together. I've never injected anything into my body. I don't think. No, I haven't. Let's unbox my delivery from Alto. Alto is a pharmacy I've used before for my progesterone that I use, endometrium, and they deliver to your door. It's so nice, and somehow, even with the delivery, it's 500 times cheaper than Walgreens, because I don't know what type of scam the United States healthcare is, but it is a huge scam. So anyways, it comes with a cute little candy. I can't wait to eat that. And then I guess here it is. Let's see what we're working with. Okay, here it is. I'm not going to show my personal information. Enoxaparin, that must be the generic name. I was instructed to do one of these injections each night. I don't know, I'm going in cold. I think I got a good enough explanation from Dr. Aimee, so let's just see how it goes. I'm unboxing my needle, and I think, okay, what did she tell me actually? Let me see if I'm in a good spot. Got my PJs on because it's late. She told me to take my love handle and hold it, pinch it. So I alcohol swabbed my skin, which I can tell you I'm probably never going to do that again, but I'll try my best. And I think I'm just supposed to pinch my love handles kind of, not 2 inches from my belly button. And here we go, you guys. Ooh. It goes in kind of slow. Skin is harder than I thought it would be. Okay, that burns like a bee sting. And then what do you do? Like pop it up? How does that work? Woo! Okay, burns like a bee sting. Like it literally just feels like I was stung by a bee. A little aside, I've always been somebody who loves bugs and little creatures, so I've gotten stung by bees a lot of times, and that's exactly what this feels like to me. If you've injected lovenox before and I'm doing it totally wrong, let me know. I'd love a tip. All right, guys, thanks for being here for my first lovenox injection, and wish me luck tomorrow. Tomorrow is my ultrasound. I should be like 7 weeks in 3 days or so. So let's see if there's a baby. I really hope there is. I've been so nauseous, but I know, unfortunately, that doesn't mean anything. I've been nauseous for a lot of my miscarriages. So we'll just see, and I'll keep you guys updated.